We'll take a look now at some individual canine cases. This is a fairly common problem where we have malocclusion that causes tooth on tooth or tooth on tissue trauma, and it can also cause an interlock that prevents the normal jaw growth movement either of the mandible or the maxilla depending on the malocclusion. This is a class 3 malocclusion, which means that the maxilla is too short or the mandible is too long, or both, resulting in trauma of the maxillary canine, trauma of the maxillary incisors into the floor of the oral cavity or into the incisors in the mandible. In this particular patient, we have interlock that prevents the normal progression of jaw movement if the patient has the genetic predisposition to do so. So the treatment, number one, is to remove any trauma that the deciduous teeth are causing in a dog that's young, that has not had permanent teeth eruption. But number two, also remove any interlock. So looking at this patient, we can see that as long as the mandibular incisors are there, it will prevent forward movement of the maxilla, which is our ideal outcome, to try to approximate normal or get to the point where we have a normal occlusion where the maxilla is rostral to the mandible. We also have interlock with the maxillary incisor teeth on the floor of the oral cavity and preventing rostral movement, and also discomfort as well in almost all of these puppies because of the sharp nature of these incisors and/or canines hitting into the other tissue or onto the other teeth. Now, if you notice closely here, not only do we have interlock here, but if we don't remove this interlock, we also have a problem with forward movement interfering with this tooth as well if the maxilla wants to move forward. So we are going to remove all of the maxillary incisors and all of the mandibular incisors, including the mandibular canine tooth. And here you can see that we've got indentations in the tissue, so every time this puppy closes its mouth, it's uncomfortable for it. And here's the demonstration of that continued interlock. This jaw cannot grow forward because it's got interference with the mandibular canines. So we'll also remove those as well in this instance. So here are all the tooth roots, and you can see when we remove these, we have quite a long root to crown ratio. The length of those roots is tremendous in those incisors. It's definitely significant here and with the canine teeth as well, but the incisors, you can really see the effect of being able to carefully extract those without fracturing those teeth. And that I would recommend from an incisor standpoint be done on the specialist level. Anytime you have a malocclusion, it requires frequent rechecks and knowledge of the occlusion itself, and consequently referral is the best way to go with these. And there's another picture with the crown root ratio there. This is just an example of an adult dog that's had problems with occlusion, as you can see, similar to the ones before, in permanent indentation and trauma to the floor of the oral cavity.